Hi, everyone. I'm here with Ramon Soto, one of the leaders of Northwell Health, one of the country's largest health services groups. Hi, Ramon. Welcome to the Purpose Power Summit.
Scott, thanks so much for having me on.
It's a pleasure. So let's get right into it. Can you talk a little bit about how you have activated purpose inside of your organization with the Raise Health movement as a means to achieve the business objectives that you set out from the beginning?
Absolutely, Scott. So, first of all, thank you for inviting me to the summit. It's always a pleasure to chat with you. I hope the audience finds these comments valuable and thoughtful. Healthcare is one of those things that is incredibly precious, and most consumers don't realize the importance of health until they need it. It's a low interest category until you actually need services for care. And healthcare in New York, in particular, is a hyper-competitive market. Consumers have great choices. Um, it's viewed as a right. Seeking great care, receiving great care are viewed as really table stakes for any leading health system in the New York market. So for us, it was incredibly important to make sure that consumers understood the mission in Northwell, the mission-oriented nature of what we do, the good that takes place in this organization. And we partnered with a number of third-party firms to really hone into what is that white space, what is that ownable territory that helps us break out of convention. Most health systems, when they talk about their value proposition, they're talking about their place as a great place for services. They use a trope. I got injured, I got ill, I went to this wonderful place, I got better. Insert logo here. But we wanted to be different, and we really wanted to get to the essence of what health enables. And if you think about it, if you just take a step back, it enables your life, your loves, your passions. It's so much broader than just fighting for your 5 minutes with your doctor. So we launched the Raise Health movement, and that is built on the foundation of our value proposition, which is about better health for all. And healthcare, particularly through COVID, we saw all the fractures in healthcare, all the things that don't work well. It is a travesty that where you live can dictate how long you live. And Northwell has made a commitment to raise the health of everyone, that we're trying to democratize access to great care across the entire health system. It's also a call to arms to consumers so that they are in charge of their own health, and they take responsibility for raising their own health. And those are just small examples of what the value proposition means, and some of the initiatives that we've launched in the marketplace to bring this to market.
What I think is really amazing when you look at the case that you have done is, a lot of companies out there are still doing what I call soft moves. They're focused on awareness and perception. You're focused on activating people and galvanizing people and mobilizing New Yorkers and people within your organization. And the way you engage them isn't around this great innovation or this great company of ours, but rather around something that matters to all of us, our health, and in a lot of different ways. And you didn't stop there. I think, we talk about, I call them like Febreze purpose brands. They have a scent of freshness, but they don't really do anything. Whereas you have really done something, activated, and thought about it in a really differentiated way. So, for example, maybe you could talk a little bit about your unique model of engaging consumers and doing it in ways that are really just not done in healthcare. For example,
Yes.
you did shows on Netflix, Lenox Hill, which is an extraordinary show. If you haven't seen it, folks, you should watch it. You've worked with National Geographic. You have other programs underway. You even launched something called the Northwell Choir, which made it onto the top America's Got Talent. Maybe you could talk a little bit about why you're doing all these crazy things and what it has meant to the organization.
Scott, I think the energy behind all those initiatives was how do we engage with consumers differently?
Mm.
We don't want to talk at individuals. How do we invite them in to take the journey? And we use a couple of different concepts to do that. One is scarcity. So I mentioned earlier, you fight for your 5 minutes of time with your doctor, and physicians are in this esteemed place in society. How do we make them more accessible and showcase the absolutely amazing, incredible things that happen day to day in healthcare? Hollywood has figured this out for a long time. There's a reason Grey's Anatomy is so popular.
Mm.
And Northwell partnered with Netflix to create this docudrama, 9-episode docudrama called Lenox Hill. It was our first effort in what we call entertainment marketing. It's not classic branded content. I'm not paying millions of dollars to Netflix to showcase my organization. I'm literally inviting the camera back behind the scenes to understand who the physician is, who the patients are, strong character development, strong storyline development, so that you can see the work that they do every day, the miracles that take place off camera every single day. It makes for incredibly compelling content. That initial show generated over 1 billion impressions. So, you get the benefit of the brute force of all that marketing effort when people create commercials to talk at you,
Mm.
but it invites you in and you can have an exchange and you can love the characters and really build passion for the stories that are developed. That has led to a second series, a spin-off, which we're wrapping up filming with Netflix right now. We did a COVID documentary with HBO, well over 1 billion impressions globally. It was shortlisted for an Academy Award. We've done TV specials with NBC. Probably the proudest moment is the Northwell Nurse Choir. So the Northwell Nurse Choir, they were discovered by America's Got Talent. If you just reflect back, we went through a terrible 2 years, and you had this army of individuals who ran towards flames to keep us safe. And they were a masked army. You never saw them. So we took a chapter out of the playbook of that cultural moment and allowed consumers to come in and see who these people were, understand how they use the healing power of music to heal themselves and to heal their patients, take the journey. A wonderful cast of characters, really deep, beautiful people. 18 nurses went through America's Got Talent, made it to the finals, and have been doing everything from the White House Christmas special to Carnegie Hall to Broadway productions, and are still in demand. I think in 2 weeks they're going to be on TV again one more time. So these are small examples of how we try to engage with individuals and just tell a very different story than what you might expect from a traditional health system.
I mean, it's incredible to have your own iconic sort of group from within the organization. It must be so motivating.
We have 78,000 associates, 18,000 of them are nurses. It has built such a strong pride in Northwell, strong esprit de corps. They are the hottest ticket in town. For Nurses Week, they're going to go to 6 of our institutions and actually sing for their compatriots. I can tell you that's going to be a very special moment for those people who are in the audience.
So Raise Health isn't your traditional healthcare slogan. Like, it starts in this wonderful hospital, or we've got the best machines, or our doctors are the best doctors. All of those are very important components of an organization such as Northwell. But Raise Health is a different idea, and it stands for taking a stand on key social issues. You talked about a little bit about at the beginning. What are some of the big issues you're going to tackle moving forward after we come out of this COVID period?
There are many aspects of healthcare that just don't serve society. And there are many aspects of healthcare where health organizations have to pick a lane to truly drive change, pick a lane. One of the largest initiatives that I'm most proud of is our gun violence prevention effort. So gun violence, it's historically been argued as a Second Amendment issue. But the reality is Over 40,000 people die each year from gun violence. Over 30,000 die from self-inflicted gunshot wounds. Gun safety is an issue. Just consumer awareness of the need to bend this curve and bring it all back to a very positive place. So Northwell's taken a stand on gun violence on a national basis. We created a gun violence prevention center, which is fully staffed, that's looking to really look across medicine and institutionalize ways to prevent gun violence. In the home, in the clinical setting, asking consumers the right questions, screening for potential cases of gun violence. It has created a national movement. We have over 200 health systems who have joined us to create new protocols in terms of gun violence screening. And it's got a tremendous amount of momentum. It's one of those things that's just the right thing to do, but healthcare has really not, because of politics, ventured into that lane. It means being brave. It means taking really progressive steps to bend the curve on health conditions that need attention. Women's health is another great example. You know, it is a travesty that over time, women are treated like little versions of men across the continuum. One of my favorite stories, you know, they use male mammals to test drugs in the original drug trials. And then they do dosing changes to adjust for gender. But body chemistry is different. Your organs are different. It's not just a size issue. And thus we need the right medicine for women that is all about women. And we profess that we see women differently, and we want to take the journey with them and we want to enable them. So we launched the Katz Institute for Women's Health, which moves beyond the traditional OBGYN view of women's health to the whole person, the whole body. And we want to invite consumers out in the marketplace to take that journey with us. There are two really small examples of dozens where Northwell has taken a stand to bend the curve in medicine and push it into a different trajectory.
Those are great examples where, you know, it's less about soft moves of perception and awareness and into engagement, right? So you're engaging people on issues that matter to them, to their families, and the communities with which they live. So to wrap it up, Ramon, I know time has flown by, and these are wonderful insights into the way you're thinking. Can you talk a little bit about your sort of mindset as a leader, as COVID, you know, was at your front door probably before any other health institution in this country, or at least one of the first. Can you just talk about how Raise Health helped you, or the approach you're taking helped you to deal with that crisis?
Yeah. So Scott, I think Raise Health, as we introduced it into the marketplace, was such a powerful platform that I chose to personally reflect on how was I going to deal with my own health. And you know, we spent 2 years of really dark days of COVID while the public saw the very public facing components of this, the news oriented components of this. We saw the everyday devastation. Northwell treated over 300,000. I think we're up to 350,000 consumers. Heads in beds, people admitted to our hospitals, thousands and thousands of deaths.
Wow.
I can tell you, I went through an emotional phase myself and worked as a leader to understand it and address it and deal with it to get myself to a better place. That took two forms. One, I needed to do something different, so I went back to the classroom and I educated myself really to stimulate the mind and to think through differently, enhance my skill sets. Secondly, on just the behavioral health component of this, really chose to be introspective on why I was feeling the way I was feeling, where I was from a behavioral health standpoint. I think the country is going to go through a number of knock-on effects from COVID. I'm worried about the behavioral health of a nation. I'm worried about millions of college kids who did not go through 2 years of normal high school. I think we have to reflect on them and model the behavior that we want them to take to get themselves to a better state of health.
Ramon Soto, Northwell Health, I think you are an inspiration to many of us. And at least for me, I just admire you and your colleagues. What an extraordinary journey. Thank you so much for joining us today. This has been wonderful.
Scott, thanks so much for having me. Really enjoyed the conversation.